We're talking now with the lovely Ruth Morrow, who is a respiratory nurse specialist at the Asthma Society of Ireland. Ruth, you're very welcome to Disability Matters.
Good morning, John. Thanks very much for having us on this morning.
It's absolutely our pleasure. Might tell us a bit about asthma, including some of the signs and symptoms.
Okay, so asthma is a respiratory condition affecting the chest, but it also affects the nose as well. So your airways start in your nose right down to the bottom of your lungs. So the airways get inflamed, get very red and angry as a result to exposure to a specific trigger. These triggers can be absolutely anything. From house dust mite to pollen to stress to hormones to weather. There's about 15 or 16 different triggers. Not everybody will have all triggers. Some will have all of them. Some might only have two or three of them. Exercise is another one, really common one for most people. So that irritates the airways, and as a result, then it makes people get wheezy, short of breath, get tightness in their chest, or cough. So to have a diagnosis of asthma, you have to have at least two of those four symptoms.
Okay.
Most people will have three or four of them, and that's perfectly fine. But if you have just one of those symptoms, then that is not asthma, that is something else.
Okay.
So a minimum of two, and these symptoms can affect you any time of the day or night. Big red flag is when they do affect you during the night or in the early morning. So that's a sign that asthma is not controlled if you have those symptoms. And if you haven't been diagnosed with asthma, you should always be asked about if you're having symptoms during the night or in the early morning, because that's always a big red flag for a diagnosis of asthma.
Very good. Do we know how many people in Ireland have asthma?
Yeah, we know that there's about 450,000 people living with asthma. Now that figure is that's there for the last number of years.
All right.
Given that our population has increased, chances are it's probably nearer to 500,000, it's near to 500, thousand. About 10% of our population has asthma. Bit higher in kids, it's probably a little bit higher in children, which would lead you to think that some children grow out of their asthma. We actually never use that term grow out of your asthma, because what we say is your asthma goes to sleep,
Yeah.
and it can wake up again. And you go on and you do, maybe you become an elite athlete, that will be a trigger to trigger it again. Or, you may take up a new job that might trigger it also. So there's lots of different things. And of course, you can develop asthma at any time of your life, whether about just age is no barrier. It doesn't matter. You can develop it at any stage.
And you can have it for all of your life,
Yes, most definitely.
like
Yes.
me.
Yeah, a lot of people do have, most people do have it for all of their life. Yeah.
So, yeah, we know how many people have, and you told us a few of the triggers. They're important, aren't they? They're important to know.
They are very important to know. And the other thing, I suppose, whatever you present with initially to get an asthma diagnosis, those triggers can change and you can develop new triggers as you progress through life. So it's really important to know your triggers, because it's to manage your triggers is the first step of asthma management. Now, there's some triggers you're never going to manage,
Yeah.
get rid of or can avoid completely. For example, house dust mite, impossible to avoid it. So, but you can minimize it. So we can give you tips and tricks to help minimize the triggers and help you manage your triggers. So, but it is the first stage of the treatment of asthma is managing those triggers. Yeah.
Right. And can you talk us through an attack,
Yeah. So,
please?
yeah. Not everybody experiences an asthma attack, thankfully, but a lot of people do. So it's really important to know what to do in that. So we have a five-step rule, which is the
Right.
first aid treatment for an acute asthma attack. So this is what you can do yourself at home. The thing is, if you do have to do this, it's really important that you get follow-up advice afterwards. So even if it happens to you at 2 o'clock in the morning or 3 o'clock in the morning, which does happen a lot, it's really important that you get, looked after, whether you go to doc on call or go to your emergency department or see your GP the next morning, because we need to know why you actually have this attack.
Yeah.
So the five-step rule is, number one is to sit up and stay calm. Don't lie down. You're not going to want to lie down because you'll be too uncomfortable. So stay upright, stay calm. The second step then is to take slow, steady breaths. So nice, big, deep breathing. And the third step is to get your blue inhaler, your reliever inhaler, preferably with a spacer. And for an adult, for children over 6 and for adults, you take one puff every minute for 10 minutes. And for children under 6, they get 6 puffs over the 10 minutes. Really important thing to do that has come out in the latest bit of research is that every time you take a puff of that inhaler, really important that you take it out of the spacer and shake it before you take the next puff.
Yeah.
Um, so always shake the inhaler before you start using it and then take it out and then shake it again and then away you go. So the other thing, I suppose, one thing I suppose that people are concerned that they're actually overdosing or taking too much Ventolin, but in this situation, do not be afraid. Take your blue inhaler or your Mart inhaler, whichever one you have. And the Mart 5-step rule is slightly different, but literally for the regular 5-step rule is 6 puffs over 10 minutes. Then the fourth step then is to call 999 or 112 if your symptoms haven't improved within 10 minutes. And the fifth step then is to repeat step 3 if the ambulance hasn't arrived in 10 minutes.
Right.
So unless you're living in the centre of Dublin, you're probably not going to get an ambulance in 10 minutes. So don't be afraid to repeat step 3 if you have to. And the important thing is then if you're with somebody that actually is having an asthma attack is that you do not leave them on their own
Yeah. And don't panic.
and don't panic. Exactly.
And it's very easy to panic when you
Of
see
course it is.
somebody
Yeah.
having it. I've had a few. I've had a
Yeah.
few way back, and I haven't had one for a long time, thank God.
Mhm.
And I always found that I was the calmest person, and everyone panicked around me.
Very true. Really important not to panic. Once you get that blue inhaler, it will start working. It does start working very quickly within 5 minutes. So, it's important to keep taking it. And if you're on a Mart inhaler, it'll actually start working within 3 minutes. So, it does work. So, and use the spacer with it because it'll get the medication down into the lungs.
Now, a lot of people have asthma and they have inhalers, but they don't know the correct way to use them.
Mhm.
Can you talk us through that?
Yeah, every inhaler, there's lots of different types of inhalers out there. There's the meter dose inhalers, which is the regular one most people will be familiar with. There's lots of different dry powder devices, and they all have different ways of using them, but the techniques for them then are slightly different as well. So the important thing about inhaler technique is that you have it checked frequently. So go to your GP, go to your pharmacist, go to your practice nurse, have the technique checked. The other thing you can do as well is I actually can check people's techniques. If you send me a message on our WhatsApp messaging service, we can actually check your technique. We can arrange a video call with you, or you can send us a video of you using your inhaler, and then I can kind of get a good idea, that you're getting the correct breath in for the type of inhaler that you're actually using. So we can give you that number later on as well for the WhatsApp service to do that. But it is really important to get it checked. And even, it's important to get it checked frequently as well because we all pick up bad habits, for doing things that we're doing on a regular basis. So, it is important that they are checked.
Yeah. And the main thing is to get the most of the dose into your lungs.
Exactly.
Yeah,
Yes.
yeah.
Like for example, with the blue inhaler that I was talking about there, and I was saying about using a spacer with it, using that blue inhaler directly into your mouth actually is total waste of time. And most of that medication is not going into your lungs at all. It's sitting in your mouth and throat, and that's no good.
Yeah.
So to get that down into your lungs, you need to use a spacer with it, or use a dry powder device, and then you get the medicine down into the lungs correctly.
Very good. And tell us what the diagnosis is like.
Yep, the diagnosis then is it can be tricky and very tricky in young children, particularly those under 5. It can be very tricky in elderly patients, people, might have other conditions as well that can maybe, breathlessness as a result can be a result of a lot of things. Like, for example, if you're anemic, you can be breathless. If you have an underactive thyroid, you can be breathless. So as you get older, then it gets gets a little bit trickier to make the diagnosis. So, a good history taken that your GP or your practice nurse should be taking, a good about your symptoms, about what has triggered your symptoms, how often you're getting them, when you're getting them. Then the next thing then is to do an objective test, something like a spirometry test or a peak flow test where you can blow into a machine and we can see what's going on in your airways. And then there's another new test out that we're using a lot now as well called the pheno test, which is a little bit easier to do than doing spirometry. But again, it's a good guide. It's not doesn't tell you for definite, but it gives us, we pull all this information together and then we can make a diagnosis. Sometimes then you might be asked maybe to do your own peak flow at home to monitor your peak flow twice a day, and we give you a diary and you go off and you do your peak flow morning and night, and you come back to us in 2 or 3 weeks and we have a look at your diary and we can see then what way your peak flow readings is. So again, with somebody that actually hasn't been diagnosed with asthma and might have it, we will see that their peak flow readings tend to be lower in the morning time than in the evening time. So that would be a kind of a telltale sign for us as well.
And that's a great idea, I think, now the asthma diary.
Yeah. And
It,
it's good not just when you're getting diagnosed, but it's even good, for a management and educational tool for yourself as well, to see you can see that your medicines are working and that your asthma is controlled as well.
and then I see that there are two different types of asthma. Tell us a bit about them and how they differ.
There's plenty of different, there's actually quite a few different types. We
Right?
have the kind of, there's like, for example, there's exercise induced asthma, which is just solely triggered by exercise and no other trigger. That happens in about 5% of the population. We have severe asthma, which happens in about 5% of the population. Those people that have severe asthma end up in secondary care in the hospital with the consultant and maybe on biological therapy.
Okay.
Then we have things like allergic asthma, which is the one, that's triggered by hay fever, house dust mite, the big allergens. And then we have the non-allergic type asthma, which is triggered by things like smoke, viruses, hormones, strong smells, those sort of things. Some people actually have a combination of the two of those. So yeah, there are a few different types of asthma out there. So it depends, and basically it does kind of depend on what the triggers are that will actually kind of now to be honest with you, we rarely never kind of classify people really.
Yeah.
There are some, yes, we do, but for the majority we don't because they will have a combination of different triggers anyway. So yeah, it can be.
So you have asthma and that's it.
That's it, yes.
Right.
And
And
the
what
other
about
big
treatment, medication? Is it always just medication?
Yes, it
Right.
is. And the main treatment is to get onto the inhaled steroids. So that is because that treats the redness and the swelling in the airway that's actually causing your symptoms. So we can dampen that down. So I do say this is like if you had a patch of eczema on your skin, which is red and itchy, that's similar to what's going on in your lungs.
Yeah.
And normally what you do is you would put a bit of steroid cream on that and it calms it all down. So if you put a steroid into the airways as well, it'll actually calm it all down. So, and you take that every single day, regardless of how good you're feeling, even if you're 100% well and you still take that controller inhaler because if you stop it, it'll just start flare up again. So sometimes another good way of describing asthma is like it's like a volcano in the airways. So you have this rumbling going on all the time in the airways, and that's what the controller will manage that. And then it suddenly erupts, and that's when you get an acute asthma attack. So, and then to treat that, that's when we use the blue inhaler or the reliever Mart inhaler. So, if you're using that blue inhaler more than twice a week, that would tell us that your asthma is not controlled, and we need to kind of have a look at your controller treatment, maybe change it or increase it.
Right.
At different times of the year, then with controller treatment, you may be able to reduce it a bit. Some people actually will be able to reduce it over the summer, particularly with children, get onto a lower dose. And then before they go back to school, they might need to increase it again. Other people might need to maybe have a lower dose over the winter time because summertime is their problem time due to the pollen counts. So, treatment can be changed. We call it moving through the steps. So you can go up and down depending on what your symptoms are. But the idea of treatment is that you are on the lowest dose of steroid in your airways to manage your symptoms. That steroid that's going into the airways, it's one thing that people get a wee bit alarmed about. Is it going to harm them otherwise? It won't. Uncontrolled asthma will actually harm you more. So it's so small, the amount of steroid that's actually going into the airways, that it doesn't get absorbed into the bloodstream. So it doesn't cause all the other side effects that tablet steroids can cause.
Right.
So every time you get a course of steroid tablets, that's going to cause problems. So we want to avoid that. So we avoid that by making sure that you're on the right amount of inhaled steroids, which are safe. Now, for some people that are on higher doses of inhaled steroids, there may be an issue with them. But that means your consultant with that will monitor that and kind of make sure that you are safe.
Now, you can actually live a long, healthy life with
Of
asthma.
course. Yeah, of course, yes. And we would say, like, particularly to parents as well, we obviously want people to be active, physically active. Physical
Yeah,
activity is so important.
yes,
So we want children to be active and out and about and being involved. So that's why, getting the asthma reviews done regularly, making sure that your asthma is as controlled as possible, always carrying that blue inhaler with you or the
yes.
reliever inhaler with you is really important. And the other thing is to tell people that you have asthma, and and particularly sports coaches, teammates, tell people that you have asthma because if they don't know, they're not going to be able to help you out, or they'll be wondering what's happening to you. If you do get suddenly wheezy, and you'll frighten them more than you'll frighten yourself. So, so just tell people and have that communication open.
I've had asthma myself for a long, long, long time. I'm obviously 21 and a bit now, but it's way back in the 70s. I was told I had asthma. And one thing, piece of advice I was told that when you're playing activities, playing sports or anything like that, use your reliever
Mhm.
before you start. Is that still the case?
Yeah, it is for a lot for most people. Yes, they will be advised to use that blue inhaler beforehand. Um, Now there is a bit of research out there that would say, well, actually, if your airways aren't actually closed in, why would you take it? And
Yeah,
that's fair enough. Now if you're on a Mart inhaler, definitely I'd be saying take it because you have a little bit of steroid in that, and that'll actually protect your airways anyway. So, but yes, the recommend if you've been told to use your blue inhaler before sport, do so, and take it 15 minutes before exercise. Make sure you warm up properly. Make sure you're well hydrated because we need to keep those airways well hydrated because if they dry out, you will get symptoms that'll irritate you. So hydration, I say, good warm up, and then the blue inhaler beforehand.
very good. Now, if we get on down to the Asthma Society, do we know when that came on stream and how?
Yeah, the Asthma Society was 50 years old there a few years, about 2 years ago, 3 years ago. And so we offer patient support services to anybody that actually has asthma or to carers or to parents. So we have two patient support services. One is the WhatsApp messaging service, which I mentioned there. So you can send a message into WhatsApp, and myself or Sam will get back to you and give you any sort of advice, send you videos on how to use your inhaler correctly, give you lots of top tips for managing your triggers. We have lots of little top tip graphics that can help you manage, for example, house dust mite in the home. We can send you videos on the 5-step rule. We have a video, an actual little kind of like a wallet card type thing on the 5-step rule, really handy to have on your phone
Yeah,
because then you can share it with people. So, and the number for that then is 086 059 0132. And then the other patient support service we have is our advice line. So you can call the advice line and book an appointment with one of our nurses. We have a wide range of nurses. We have some pediatric nurses. We have a nurse that runs a severe asthma clinic in her workplace. So that can be useful for people that have severe asthma. We have a physiotherapist as well. And you can book an appointment with Barry as well if you need kind of any, breathing exercises, which can be very useful.
very.
And that number is 1800 44 54 64. There's also a form actually on our website on asthma.ie where you actually can just complete it and send it in that way either if you don't want to phone up. So
Yeah.
you have a couple of ways of doing that. But asthma.ie there, when you log on to it, you'll see there to book, you can see book a call with the advice line and just kind of complete that form and send it in.
Are those numbers on your website?
They are indeed, yes.
Brilliant.
Yeah.
Now, how many members do you have? You said there was
Um,
500,000 people who have it.
Well, yeah, exactly. So that potential is there. So we don't really operate a membership system.
Okay.
So people, if you want kind of information, regular information from us, you can sign up to our emails. And as far as I know, you can do that there from the website as well. And you'll get regular updates of what's going on with the society and any kind of new groundbreaking information that comes out, we can send it as well. So you can sign up for those emails and you get kind of regular communication from us.
Lately, I've started to ask this question of most charities. Are people referred during the diagnosis to the Asthma Society?
Yes, sometimes
Yeah,
yes, because
good.
yeah, healthcare professionals actually have access. They have a referral form on the website there as well, and they actually have it on their own computer systems in practices, like in GP surgeries, they'll have it, and they actually can complete it and refer patients in as well. And that, yes, we do get a lot of practice nurse and GP referrals from that, and referrals from the integrated care hubs as well.
That's brilliant. And you're the first one to say yes, can I say? Which is great. Now, we're right at the end of the interview. You've been delighted to know. Have you anything else to add before we go?
Uh, no, I don't think so. I suppose this time of year, kind of, with the warm weather, it's been very problematic for patients. And particularly with thunderstorms, there are all these different triggers around. So I know we noticed there on our WhatsApp messaging service, we are getting lots of queries about that. So it is important, different times of the year, there will be different things that will affect people. So, and like that, I say we have all those top tips and triggers for different times of the year as well that we can send on WhatsApp. So, so the services are there, so use them.
Now, I'll ask you just to repeat those contact details, including the website, so that people can get in touch if they're in need.
Yeah. So the website is asthma.ie, which is straightforward enough. The advice line number is 1800 44 54 64. And then the WhatsApp number is 086 059 0132.
And the website?
Asthma.ie.
Very good. Ruth, thank you so much for talking to us at Disability Matters.
Thanks very much, John, for having us on today.
It's our pleasure, and thank you for coming on.